Recombinate Vial is used to control and prevent bleeding episodes in people with low levels of factor VIII, hemophilia A. It is also used in these patients before surgery to prevent bleeding. People with low factor VIII levels are at risk for bleeding longer after an injury/surgery and for bleeding inside the body, especially into the joints and muscles. This product contains a man-made form of factor VIII, also called antihemophilic factor. This product is used to temporarily replace the missing factor VIII, a protein, clotting factor, that is normally in the blood, so that the blood can clot and the bleeding can stop. It's important to note that this medication should not be used to treat von Willebrand disease. As for the daily dosage and optimal timing, it is best to consult with a healthcare professional to determine the specific needs of the individual. This medication is given by injection into a vein as directed by your doctor. The medication may need to be given more slowly over a longer time depending on your dose and how you respond to it. After first receiving this medication in a hemophilia treatment center or hospital, some patients may be able to give this medication to themselves at home. If your doctor directs you to give this medication at home, read the patient information leaflet available from your pharmacist before you start using this medication and each time you get a refill. Learn all preparation and usage instructions in the product package. Learn how to store and discard needles and medical supplies safely. If you have any questions, ask your healthcare professional. If the medication and the solution used to mix it were refrigerated, bring both to room temperature before combining. After adding the solution to the powder, gently swirl the mixture to completely dissolve the powder. Do not shake. Before using this product, check it visually for particles or discoloration. If either is present, do not use the liquid. Use right away according to the product instructions. The dosage is based on your medical condition, age, weight, blood test results, and response to treatment. Follow your doctor's instructions closely. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Recombinate Vial include flushing of the face, headache, nausea, and fast heartbeat. These can be reduced by administering the medication more slowly. You may also experience burning, redness, or irritation at the injection site, as well as fever and chills. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you outweighs the risk of potential side effects. While many people using this medication do not experience serious side effects, it's important to be aware of the possibility of a rare but very serious allergic reaction. Seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, trouble breathing, or chest discomfort. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Recombinate Vial, make sure to inform your doctor or pharmacist if you are allergic to any antihemophilic factor products or if you have any other allergies. Some brands may also contain inactive ingredients that can cause allergic reactions or other problems. Make sure to discuss this with your pharmacist for more details. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have a certain type of hemophilia, congenital hemophilia A with inhibitors. If you are pregnant, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Some manufacturers recommend monitoring your heartbeat during treatment, and if your heart starts to beat faster, it is recommended to give this medication more slowly or temporarily stop the infusion until your heart rate returns to normal. Be sure to consult your doctor for more details. When taking Recombinate Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. As for the use of Recombinate Vial, it is primarily used to prevent bleeding episodes in people with hemophilia A. The dosage and timing of administration will vary depending on the individual's condition and their doctor's recommendations. It's important to follow the prescribed dosage and administration schedule for optimal effectiveness. If someone has taken too much recombinate vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Alternatively, you can also contact a poison control center for assistance. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for support. It's important not to share recombinate vial with others, as it is specifically prescribed for your condition. Your doctor may recommend regular lab tests to monitor your factor VIII levels while using this medication. It's important to keep all medical and lab appointments and consult with your doctor for more details on the frequency of these tests. This will help ensure that you are getting the most benefit from recombinate vial and that it is being used effectively to manage your condition. Remember to always follow the dosing schedule given to you by your doctor. If you happen to miss a dose, make sure to consult with your doctor or pharmacist to get a new dosing schedule. It's important not to take double the dose to make up for a missed one. Make sure to store recombinate vial as directed by the manufacturer. Do not freeze it and keep it away from light. Once mixed, use the product within the specified time frame and discard any unused portion. Keep all medications out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.